Hello and welcome to the New Indian Express. Kerala is facing a new health crisis, an infection that comes from a single cell organism called amoeba. The state has witnessed 17 deaths from amoebic meningoencephalitis in the last 9 months. Initially, health experts believed that the infection primarily affected people who had taken bath or swam in ponds, lakes, or swimming pools where contaminated water entered the nose and allowed the amoeba to reach the brain. However, recent cases have raised concern, including in which a 3-month-old infant with no exposure to ponds and individuals who had only taken bath at home also contracted the disease, challenging earlier assumptions. So now Kerala is dealing with an infection whose modes of transmission and prevention methods are uncertain. We will be talking to Dr. Rajeev Jayadevan, an expert who was the co-chairman of the National IMA COVID Task Force, who shall give an expert view on the subject.
Meningoencephalitis refers to infection of the brain and the coverings around it. Now, infection of the brain is serious business. Sometimes it can lead to death, and in a few people who recover, there could be permanent disability. There are many organisms that cause meningoencephalitis. Most of them are viruses and bacteria. But amoeba are among the rare organisms that also cause meningoencephalitis. So if you take all the cases of meningoencephalitis, the ones caused by amoebae are quite rare. Now, amoebic meningoencephalitis is caused by a few species of what is called free-living amoebae. Now, free-living amoebae are part of our environment. They live in the soil, in the water. They live in water pipes, water tanks, wells, rivers, streams. They are everywhere. There are hundreds of species of free-living amoebae, of which 3 or 4 are linked with infection of the brain, and some of these species include Naegleria, Acanthamoeba, Balmuthia, and Sapenia. The most lethal form is called Naegleria, which in fact, if it causes meningoencephalitis, it can carry a mortality upwards of 95%. Often these cases are diagnosed late, so the patients do not get the benefit of early treatment, which explains the relatively high mortality reported. Kerala is seeing a rise in cases because of greater awareness of this condition. When you diagnose a case of meningoencephalitis, you need to examine what is called the CSF, or cerebrospinal fluid, which is a fluid that constantly drains around the areas around the brain and the spinal cord. So it is done it's collected using a spinal tap, using a long needle inserted into the back. So this fluid is subjected to various types of analysis, and commonly people do not look for amoeba in this fluid. But when you start looking for amoeba in the right setting, in a person, say for example, who's been swimming in a river or has been exposed to a pond or uses water to flush that person's nose, yes, such an individual could be at greater risk of having amoeba as a cause of the infection. Now, the symptoms of meningoencephalitis are the classic triad of headache, fever, and vomiting. Now, all cases of headache, fever, and vomiting are not meningoencephalitis, but if somebody presents with these 3 symptoms, they must check with the doctor and undergo testing if necessary to see if it is an infection concerning the brain. And while evaluating such cases, if the doctor suspects amoebic infection, yes, the doctor will subject the fluid to additional investigations. For instance, the doctor may send the fluid to be examined under the microscope by a specialist doctor who knows what amoebae look like. It's not easy to diagnose amoebae. So it's a case of increased awareness, increased diagnosis, and change in the diagnostic protocol that has led to revealing of this cause of infection. Now, meningoencephalitis is not a rare condition to India. For instance, the first case was reported in West Bengal as early as 1971. And that happened because doctors at a children's hospital decided to look for it. So they looked at the CSF samples of children who came in with meningoencephalitis, and they found 2 cases. And the patients did not die. So it's a case of greater awareness and better detection capabilities. Free-living amoebae are seen everywhere. And among free-living amoebae, the pathogenic ones, the ones that cause human infection, can also be seen occasionally. It depends what samples are present where. Amoebae live not only in ponds and streams and swimming pools and water tanks and wells, they also live in our own water pipes, water taps, water heaters, inside what is called the biofilm. See, if you look at the inside of a pipe, I say a plastic pipe that is supplying water, you'll find a slimy material on the inner lining, and we call it biofilm. And biofilm is a living layer of bacteria, algae, fungi, and also amoebae. So the water that flows through these pipes also could have amoebae. In fact, there is a case report from the US of a man who used to rinse his nose with water periodically. That was his habit. He used to wash the inside of his nose using water from the tap, and he died of amoebic meningoencephalitis. And when the authorities checked his water supply, they found the same amoeba in his water supply, in the pipes in this person's home. So that is proof that amoeba need not necessarily come from swimming in the river. But for the most part, the cases of amoebic meningoencephalitis come from water entering the nasal cavity, the nose, in substantial amounts. Now, the nose is designed for breathing. It is not designed to take in water. When we take a shower, yes, a couple of drops can get into our nostrils, but the nose is situated much deeper inside, and it is composed of an array of cavities, and water can in fact get stuck in these cavities. And if it is dirty water, yes, these bacteria and other germs and amoeba that are present in the water can stay for a long time in the nasal cavity. The distance between the nasal cavity or the nose cavity and the brain is actually quite small. The separation is by a thin bone, which is almost like the size of a small fingernail, and it's a relatively thin piece of bone. It's called the cribriform plate. So if the amoebae that are swimming around in the nose or moving around in the nose are able to penetrate this bone, which is actually porous, it can get access to the brain. It can reach the brain. And it does so by burrowing through the nerve that helps us smell things, and that's called the olfactory nerve. So the olfactory nerve comes from the brain through this bone, and the nerve's endings are in our nose. So that is how we are able to smell things. So the amoeba in the nose can go in the reverse direction, pass through the nerve, through the bone, into the brain, and cause infection and death. So that is the story of amoebic meningoencephalitis. It's not a new outbreak. It's probably been there for a very long time. It is just that these cases are being diagnosed better now. The question of how to protect oneself is very interesting. See, it is impossible to get rid of free-living amoeba from our environment because they are part of our environment. Even if you try to chlorinate them or clean up your environment, these organisms live. They feed on bacteria and other organic matter, and when threatened, they can switch into what's called the cyst form. See, the amoeba commonly has two forms in its life cycle. Some have three. So the two forms are what is called the trophozoite, which is the classic amoeba that we draw in our school notebooks, that looks somewhat like a fried egg with a central nucleus, a central dot, and an irregular what's called pseudopodia. This is called the trophozoite, and it's mobile, which means it can move from place to place. The other form is called the cyst form. It is similar to a seed. So when the amoeba is threatened or when its environment is not favorable, the trophozoite switches into cyst form, which can resist adverse circumstances for a long period of time, and then it can revert back to the trophozoite form whenever conditions are favorable. So it's impossible to get rid of these organisms, and perhaps we should not get rid of these organisms because they are part of ecology. There's so much water around, we use water every day, but what we can do meanwhile is to reduce its access into our nose. See, it's okay for a couple of droplets to fall into the tips of our noses, which is called the nostrils, while washing our face. But if there are people out there who draw water into their nose, that is something that must be discouraged. And those who go swimming, must take the most care not to get too much water into their noses. And when children swim in such conditions, they must also be instructed not to spend too much time underwater and definitely not try experimenting taking water through the nose. There are people indeed out there who habitually put water into their nose for various purposes, and that is something that I cannot agree with. From a medical standpoint, there are very rare instances in healthcare where a qualified doctor may instruct the patient to do so, but that is done using distilled or sterilized water, which is basically free from pathogens or free from germs. To summarize, do not put water deep inside your nose. Do not take water into your nose. That's the best precaution I can advise. And if somebody has the symptoms of fever, headache, and vomiting, see a doctor. And the doctor may suspect an infection of the brain or its coverings around it, or both, and do appropriate testing. If treated early, the story in Kerala, they have shown that if you diagnose early and start treatment measures early, patients can survive. Yes, it is not as lethal as it's commonly reported. Perhaps because of early treatment, the mortality might have come down. Cases of amoebic meningoencephalitis are reported not only from Kerala but also other parts of India. But the problem is, it's perhaps not on people's minds when people present with symptoms of meningoencephalitis, and perhaps it's not tested frequently enough. Perhaps one of the reasons why these cases are not being reported elsewhere in big numbers. There are several reports from the United States and from elsewhere, especially from warmer parts where these amoeba tend to thrive. The amoeba tends to do better in temperatures in excess of 20 degrees, which is quite common in tropical parts of the world. And amoeba, they tend to, in a river or a stream, they tend to live in the dirt at the bottom. And when children splash around as part of their activity in the water, yes, these amoeba can come out in large numbers and sometimes get into their noses.